So what exactly is blood pressure? It is the force of blood pushing against the walls of your arteries. Arteries are blood vessels that carry blood from your heart to the rest of your body. Your heart pumps blood with each beat, creating pressure. Think of it like water flowing through a hose. Blood pressure works in a similar way inside your body. It is a vital sign that tells us a lot about your health. Monitoring blood pressure is very important for health. High blood pressure or hypertension often has no symptoms but can silently damage your organs. Low blood pressure or hypotension can cause dizziness or fainting. Regular checks can detect issues early. Knowing your numbers helps you take control of your health. When you get a blood pressure reading, you see two numbers. The first or top number is the systolic pressure. This measures the pressure in your arteries when your heart beats. The second or bottom number is the diastolic pressure. This measures the pressure in your arteries when your heart is at rest. Together, these two numbers give a snapshot of your blood pressure. For example, a reading might be 120 over 80 mmHg. Understanding both numbers is crucial for a complete picture. Section 4. Preparing for success. Getting the patient ready. Proper patient preparation is essential for an accurate blood pressure reading. If the patient is not prepared correctly, the reading can be wrong. This could lead to incorrect diagnosis or treatment. The patient should feel comfortable and relaxed. A calm state helps give a true reflection of their usual blood pressure. Explain the procedure to them briefly to reduce anxiety. Before taking the measurement, the patient should be relaxed. Ask them to sit quietly for at least 5 minutes. They should avoid caffeine, smoking, or vigorous exercise for at least 30 minutes prior. Ensure their bladder is empty. Choosing the correct arm is also important. Usually blood pressure is taken on the left arm. The arm should be bare. Ask the patient to roll up their sleeve. Make sure the clothing is not tight or constricting on the upper arm. The patient's position during the measurement is critical. They should be seated comfortably in a chair. Their back should be supported by the chair. Their feet should be flat on the floor, not crossed. The arm you are using should be supported and at heart level. Correct positioning is key. Section 5. The art of the cuff and stethoscope. Proper application. Applying the blood pressure cuff correctly is a vital step. An improperly placed cuff will lead to an inaccurate reading. The goal is to ensure the cuff can evenly compress the brachial artery. Take your time with this step to get it just right. First, you must choose the correct cuff size for the patient's arm. Cuffs come in different sizes: small, medium, adult, large, and sometimes thigh cuffs. The inflatable bladder inside the cuff needs to be the right proportion. If the cuff is too small, the reading will be falsely high.